On this Wednesday night, cautious moves to relax some pandemic restrictions. The Prime Minister pleads for patience.
We need to hold on, still.
As fears deepen for Canada's most vulnerable and the staff who care for them.
They support us and they encourage us and they hold us when we cry.
One province has promised to deploy a SWAT team of health workers. The emergency response benefit expands again. Who else is now eligible for aid? Meat production disruption, the changes you could see at the grocery store, and proving the point of physical distancing. What's behind the 2-meter rule?
Global National with Dawna Friesen.
Good evening and thanks for joining us. Lots of developments to get to on this Wednesday, from new financial support for Canadians to Ontario's plan to send SWAT teams into long-term care homes hit by outbreaks. And the world has reached another alarming milestone in this pandemic. The number of confirmed cases worldwide has now surpassed 2 million. And here in Canada, more than 1,000 people are now known to have died from COVID-19, and more than 28,000 people have been infected. Here's a snapshot of where things stand today. More than 1,300 new cases were reported across the country. Quebec and Ontario are still seeing the biggest spikes. Some provinces, though, have no new cases reported, and Canada's public health officer says there's reason for cautious optimism.
In late March, when the growth rate was the fastest, we saw case numbers doubling every 3 days. But in recent days, we've observed a doubling time of over 10 days. This means the epidemic is slowing down.
With early signs the curve may be flattening, there's talk in some provinces about how to begin easing some restrictions. In Quebec, some businesses like auto mechanic shops and garden centres were allowed to reopen today. Quebec's premier says he's working on guidelines to allow more small businesses to reopen soon. Saskatchewan is also working on a plan. It's seen a slowdown in new cases, and Premier Scott Moe says if that continues, some businesses will be allowed to slowly reopen, but life won't be fully back to normal anytime soon.
Travel, large gatherings, and our seniors' care homes. We know those are 3 very high-risk areas, and we will not be removing those restrictions in the foreseeable future.
A similar plan is being worked on in British Columbia. Premier John Horgan extended that province's state of emergency today, but he says progress has been made in slowing the spread there, and talks are underway to start easing restrictions, including potentially restarting classroom education in the not-too-distant future.
I look at my colleagues across the country who set arbitrary dates for a return before the data was in, before the science was confirming that, and we're not going to follow that lead. We're going to look at the numbers as they emerge over the weeks ahead before we make those determinations.
In Nova Scotia, where 32 new cases were reported today, officials say they're still weeks away from any talk of reopening.
Let me be clear, we're not there. So before anyone communicates to Nova Scotians that we're not going to open up in 2 weeks or 3 weeks, we're not there. We need Nova Scotians to stay committed to following the public health orders.
Prime Minister Justin Trudeau is talking with the premiers about all of this. There are many regional differences, and he's warned Canadians it's going to be a long, slow process. And right now, we can't give up keeping physically distant and slowing the spread.
It seems like over the past days, people are talking about, oh, when we reopen this, we'll do this, we'll reopen that. It's not happening yet. If we reopen too soon, everything we're doing now might be for nothing. We are making sacrifices. We're there for each other. We need to hold on. Still.
There is still a crisis unfolding inside long-term care homes, where at least half the deaths from COVID-19 have happened. Ontario's premier says SWAT teams of healthcare workers will be sent to homes overwhelmed by outbreaks. Quebec's premier has appealed to doctors and nurses for help. And today, Prime Minister Trudeau says he will talk to the premiers about boosting the wages of long-term care workers.
As we face an unprecedented threat to public health, you are our most important line of defense. We will do whatever we can to help you do your job and support you through this time.
And as Ross Lord reports, lawyers say families with loved ones in long-term care are reaching out to them looking for help, some asking how they can sue the homes.
At this nursing home in Toronto, more than 20 residents have died from COVID-19. The higher the death toll at care homes rises in Canada, the more families fear victims like 89-year-old Phyllis Thompson will be forgotten.
I didn't want her to just to be a statistic that there's another one.
British Columbia and Alberta already limited staff to working at just one care home at a time. Now Ontario's followed suit. The province promises an immediate influx of personal protective equipment and a SWAT team-style shift of staff from hospitals to nursing homes.
That's being rolled out as we speak over the next 24 to 48 hours. It's already happening regionally in some areas. We're going to make sure that that happens across the board.
In Quebec, the government is pleading with doctors to come and support nursing home staff. The Premier has already suggested soldiers might be required. He now promises to investigate a double standard surrounding criminal background checks. This after two newspapers reported on the past criminal record of the president and co-owner of a home where more than 30 people have died in the past month. His family says he was pardoned.
I've asked my people to check how come we have some background checks for employees, but not for owners taking care of elderly. So I was surprised to hear that.
The gaps in long-term care exposed by the virus become more tragic by the day, and they become more frightening, especially in provinces like Nova Scotia, which has the highest proportion of seniors in Canada.
If you put a system that's already struggling, already understaffed, already underfunded, and then say, could you do some more because we've got this struggle in front of us? Well, our staff only have so much to give, and they're giving it.
There are growing questions about safety culture. Ontario has reportedly made deep cuts to full inspections, and a union that represents nursing home staff says operators get advance notice of inspectors' arrival so they can give the appearance homes are in better shape than they actually are. Now, class action lawyers say families are contacting them about suing long-term care homes, ensuring this tragic episode will go on in various ways for a long time. Ross Lord, Global News, Halifax.
More financial help is coming for Canadians who didn't qualify when the Canada Emergency Response Benefit was first rolled out. The CERB is being expanded now to include part-time, seasonal and contract workers, as well as anyone whose employment insurance recently ran out. Michael Couteur has the details.
It would be like Christmas not happening for a retailer. It's big.
As a self-employed artisan, the countrywide shutdown means Megan Rose Babb has no one to buy the jewelry and accessories she crafts by hand. She nearly had to dip into her line of credit, but then she was given a lifeline.
We are expanding the Canada Emergency Response Benefit to include people making up to $1,000 a month, seasonal workers, and people whose EI has recently run out.
It applies to part-time workers, volunteer firefighters, and people like Megan.
It makes a lot of difference to me because now I know that I can pay my mortgage, I can pay my bills, buy food, all those things.
The CERB has meant a lot to a lot of Canadians. In the first week of its rollout, the benefit saw nearly 3.5 million applications. Anyone who has applied for employment insurance before that time was automatically put in the CERB stream, pushing the total number of applications for help dating back to March 15th to nearly 6 million Canadians. According to the government, they've processed 90% of those claims. The NDP is claiming a victory, saying they helped push the government to include more categories of workers than the Liberals originally planned. Still, Jagmeet Singh says many more need help, especially students.
We need people to stay at home, and then we're asking students to go out and apply for a job. That doesn't seem to be in line with what the public health experts are saying.
The Prime Minister says help will be coming for post-secondary students later this week, but it's unclear if they too will be allowed to apply for the CERB. And on that, government officials are reminding people who have already received the benefit that because a new pay period is about to start, they have to contact the government to reapply or reconfirm that they're still eligible for the benefit. Dawna?
All right, Mike, thanks. The American president, Donald Trump, is facing criticism for his decision to suspend funding to the World Health Organization. He blames the WHO for not doing enough to stop the coronavirus and for being too lenient on China, where it all started. The Bill and Melinda Gates Foundation is the next biggest donor to the WHO after the U.S. And in a tweet, Bill Gates said, halting funding for the World Health Organization during a world health crisis is as dangerous as it sounds. Their work is slowing the spread of COVID-19, and if that work is stopped, no other organization can replace them. The world needs the WHO now more than ever. And today, the head of the U.S. Centers for Disease Control said this.
You know, I'm just going to say that WHO's been a long-standing partner for CDC. We've worked together to fight health crisis all around the world. We continue to do that.
Because the WHO isn't just fighting COVID-19, it works with other diseases that need desperate attention, too. As Jackson Proskow reports, the huge cut in funding could be disastrous.
We regret the decision of the President of the United States.
This was not a battle the World Health Organization was prepared for, not in the middle of a global pandemic.
The WHO failed in this basic duty and must be held accountable.
But as COVID-19 cases and deaths surge in the United States, President Donald Trump has started looking for someone to blame. He's targeting the WHO by slashing funding and using his office to launch a smear campaign.
The delays the WHO experienced in declaring a public health emergency cost valuable time.
We alerted the world on January the 5th. Systems around the world, including the US, began to activate their incident management systems on January the 6th.
On January 23rd, the WHO warned cases may appear in any country. Thus, all countries should be prepared for containment. Shortly after, Trump praised their work.
The World Health Organization, and a lot of them are composed of our people. They're fantastic.
That was before the president faced criticism for his own failure to act on those warnings, when the U.S. could have rolled out proven testing and stocked up on medical supplies.
The World Health Organization is not responsible for that slow response. Again, other countries received the same information, responded a lot earlier.
The U.S. provides nearly $500 million to the WHO, about 15% of the total budget. The agency focuses largely on work in developing countries that are ill-prepared to tackle the pandemic on their own.
The World Health Organization is not like the United States government where we can go into debt. It's an organization that has to have money to kind of keep its efforts going.
Despite warnings that a failure to control the outbreak in any country will have dire consequences for every country, the Trump administration seems undeterred, pressing ahead with the fight against those fighting the virus. Jackson Proskow, Global News, Washington.
Some of Canada's less busy U.S. border crossings are about to become even more quiet because of COVID-19. The Canada Border Services Agency is temporarily cutting hours at 27 locations in BC, Alberta, Manitoba, Saskatchewan, and Quebec. The changes, which won't impact commercial traffic, take effect tonight and will remain in effect until further notice. You can find the full list of the affected crossings and their new hours on our website, globalnews.ca/globalnational. Changes are also expected at the supermarket soon. Coming up, what could be missing from the meat department. Plus, parade during a pandemic. 105 reasons to celebrate a war veteran. One of the many sectors hit by this pandemic is meat processing. As employees in plants test positive, some are closing, and that's affecting supply lines, especially for pork and beef. David Aiken explains the impact at the grocery store.
The Smithfield pork processing plant in South Dakota accounts for nearly 5% of America's pork processing capacity. It went offline indefinitely this week. Canada's biggest pork producer, Olymel, has also lost significant processing capacity. And in Calgary, Cargill has slashed production at a meatpacking plant that accounts for 40% of Canada's beef production. All of it because of workers sick with COVID-19.
So a relatively small number of these factories process a huge proportion of the meat in Canada and the U.S. And so if one of those goes down, it has a huge ripple effect across the entire industry and actually really threatens that entire supply chain.
and that ripple effect will reach consumers.
We might have some challenges in terms of variety and maybe on prices at a certain point.
We're not facing a massive food security crisis as a result, but I don't think that it will be as easy or as cheap to buy beef and pork in the next month or two as it has traditionally been.
Back at the farm, some producers are now stuck with hundreds of thousands of growing animals that still need to be fed. Southern Ontario hog farmer Stuart Skinner is okay for now, but he's worried about the future.
We're going to see, I feel, ongoing challenges due to COVID until there's an effective vaccine strategy.
Some hogs are going to food banks, others are being butchered and sold at the farm gate. Worst case scenario, some may have to be euthanized.
And the trick is to do everything we can to build in flexibility and create a more robust supply chain up and down from the farm gate right down to the grocery store.
Ottawa is trying to keep the production line moving, freeing up $20 million to hire more meat inspectors and negotiating to drop restrictions on interprovincial meat exports. David Aiken, Global News, Ottawa.
Ahead, the 99-year-old raising millions with every step. The European Union has revealed a roadmap to phase out some restrictions. The EU says all action should be gradual and monitored. Internal border controls should be lifted in a coordinated manner, and the restart of economic activity should be phased in. Gatherings should be progressively permitted, but efforts to prevent the spread of the virus should remain. Denmark has partially reopened schools after a month-long lockdown. Children up to the age of 11 are returning to some nurseries and schools. Denmark was one of the first countries in Europe to lock down, and it is the first to lift restrictions on schools. But strict hygiene measures are in place. Desks have been moved 6 feet apart and recesses staggered to limit large groups. Thousands of parents are wary, though. They kept their kids at home. The number of new cases in Denmark has been on the decline for the past several days. New Zealand's Prime Minister says if there was ever a time to close the pay gap, it is now. So Jacinda Ardern and other top government officials are taking a 20% pay cut for the next 6 months. The country is under full lockdown, and Ardern says the pay cut is an acknowledgement of the hit many New Zealanders are taking.
We feel acutely the struggle that many New Zealanders are facing, and so too do the people that I work with on a daily basis. And while it in itself won't shift the government's overall fiscal position, it is about leadership.
A British veteran who is 99 years old found his own way to show leadership, and the response has been bigger than he ever imagined. Retired Captain Tom Moore set out to walk 100 laps around his garden by his 100th birthday, which is April 30th. He hoped to raise 1,000 British pounds for the NHS, the British Health Service, but his walks have been a smash hit, and he's already raised over £10 million, and he'll give every penny to those fighting the coronavirus.
At all times, they're so good, so cheerful, so friendly, and when now, if you look at this, it says "Virtus for who comes, virtus favours the brave," and that's what they are. They're brave.
Oh, bless him. And he says the medical professionals helped him through a hip surgery and cancer. Now it's his chance to thank them. And once he's reached 100 laps, he intends to keep right on going. 2 meters or not 2 meters? Next, the questions facing one rule of physical distancing. We all know the rules now. Try to keep at least 2 meters or 6 feet away from other people. If the virus can't reach you, it can't infect you. But what's behind that 2-meter rule? Researchers at Western University in London, Ontario, looked into that question in a study about the seasonal flu. And the results are raising concerns about the transmission of COVID-19. Jeff Semple explains.
It's become a golden rule of the COVID-19 pandemic.
Please stay at least 2 meters apart from others.
Staying 2 meters or 6 feet apart to slow the spread. But a new study suggests your cough can travel even further than we thought.
We feel 6 feet is not sufficient, and you want to be more precautionary.
Researchers at this Ontario university built a cough chamber and asked patients with the seasonal flu to cough into the cube. The study found that even if you're standing 6 feet or about 2 meters away from someone who then coughs in your direction, around 10% of the cough droplets will reach you in about 3 seconds. And some of those droplets will then travel even further. One study at MIT found that particles from a cough can travel up to 16 feet. However, the bigger the distance, the smaller the viral dose, meaning the droplets are less likely to make you sick.
Of course, each droplet also has a weight. So what happens is that the heavy ones fall to the ground really quickly.
But coughing and sneezing are not the only causes for concern.
I think the jury's still out on whether COVID-19 can spread through aerosols.
There's no indication that COVID-19 can travel long distances, like measles. But there is growing evidence the virus can spread through speaking, even breathing, and linger in the air. One example, 45 members of this church choir in the U.S. became infected, even though none had any symptoms and all were avoiding physical contact.
If you're talking to a friend who's had garlic or curry or a drink over lunch, for example, if you can smell that curry, garlic or alcohol on their breath, you're close enough to inhale any virus they might be exhaling.
And the longer the exposure, the greater the risk. An infected person talking for 5 minutes in a poorly ventilated space can produce as many viral droplets as one cough. Experts say it underscores the importance of other safety measures, like ensuring proper ventilation and wearing masks, while also keeping your distance. Jeff Semple, Global News, Toronto.
And that is Global National for this Wednesday. I'm Dawna Friesen. We leave you tonight with a birthday that deserved a parade. Burdett Thomas Sisler turned 105 this week, and when word spread about his milestone, about 50 vehicles drove by, honking and hooting to wish him well. Bird, as he's known, is one of Canada's oldest surviving veterans of the Second World War. He has 11 grandchildren, 19 great-grandchildren, and 9 great-great-grandchildren. Happy birthday, Bird.